Hello, everybody. I am Saidi Khalil. I'm really glad to be here in this podcast with Jose Domingo Sanmartín. And I think this is the third podcast we are presenting. And I think it was a very nice initiative from GCEA to start talking to people that are really influenced worldwide. And then you will see a lot of a sequence of podcasts showing people. And this is important so because in the future, you will remember, you will heard about Jose Domingos, you will heard about Tom Judd, and you know the face, you know the voice. Because when we get old, then you leave the profession, but the memory will stay. So I am proudly can say that I am one of the founders or founder members of GCA, and presently I am the chairman of the Educational Program Committee. And really, it's a pleasure to be here. I will quickly present Jose Domingos. He is the chairman of the GCA Membership Committee. He's quite a new member of GCA, which is very nice. We need new minds to carry on with the GCA and to change things. José Domingos also is the head of the healthcare technology management of the Hospital Universitario Virgen de Rocío, Sevilla, Spain. Okay, he is recently elected the president of the Spanish Society of Electromedicine and Clinical Engineering, and also substitute professor interim at the University of Seville.
So thank you so much for your kindly presentation, Mr. Khalil, Professor. It's a pleasure to speak with you today. As you well know perfectly and explained before, it was a pleasure to work during the last 2 years with you in your department, doing where you are the chairman of the educational program of the Global Clinical Engineers Alliance. So thank you so much for having me to share my opinion in clinical engineering in Spain. So it's a complete luxury for me.
I remind you that I wasn't the one alone that chose you to be interviewed. I mean, it was GCA committee, and they interview you because they think you are a very important person, and I agree with them. That's why.
Thank you.
Let me start questioning you about some of the things that we would like to know about you. I mean, what attracted you to enter the field of clinical engineering?
So my decision to work in the clinical engineering, one of the most important decisions in my career was, of course, dedicated to myself, to the healthcare technology management, and especially to do so within a public hospital environment. So it's essential. So working in a hospital such as Hospital Universitario Virgen de Rocía in Seville has had a major impact of my professional trajectory. This is probably one of the largest hospitals in Spain with more than 1,200 beds, 62 operation rooms. So every decision related to medical technology have a direct impact on a clinical activity, and of course on patient safety, and of course to the healthcare quality. So that experience helped me to understand what the clinical engineering is not only about maintaining devices. It's about managing complex technological ecosystem, supporting clinical, improving, of course, process, ensuring safety, and of course, helping a hospital make better decisions regarding innovation and medical technology. So at the same time, combining the hospital experience with my academic work at the University of Seville, I need involvement in a professional society such as SAIC, and of course, the Global Clinical Engineers Alliance has shaped my career in a very mindful way. It has allowed me to connect my daily hospital practice with some educational professional leadership and an international collaboration. So I believe in this type of thing. No, this mix is important. And in many ways, the decision transformed my career and gave me a clear purpose to contribute to safer, to maintain the device safer, to smarter, more sustainable, and more human-centered healthcare through clinical engineering and healthcare technology management.
Oh, thank you. I have to say that clinical engineering is a profession, is a career profession that you really fall in love with it because you know, you understand, and you feel that you are helping patient to improve patient. This is the nice things about it. Let me ask you also, I would like to know something about your jobs and other professional roles you are also playing, meaning might be not only in your country, but even regionally. What you are doing regionally in your country, apart from everything I already presented you?
So if we're talking about that, I would like to highlight for main some milestone, no, that you're talking before. So the first one probably is becoming the head of clinical engineering and healthcare technology management department at my hospital, no, at the Hospital Universitario Virgen de Rocío in Sevilla. This has been a key milestone for me in my professional career, and of course, it's mean leading healthcare technology management in one of the largest and most complex public hospital in Spain, with, as I said you before, more than 1,200 beds and 62 operation room. So working in such a environment has given me a practical and strategic vision of clinical engineer. So in a hospital of this site, technology management is directly connected to the patient safety, as you say. So of course, also resonated with the clinical quality, operational efficiency, of course, innovation and sustainability during the time. It's also a privilege to do this type of work in Seville. Seville is a city that was named by one of the biggest magazine, Lonely Planet, as the best city in the world to visit in 2018. So I highly recommend you to visit it as soon as you can. So if we're talking about that, the second milestone probably will be is my academic career at the University of Seville, where I teach some subjects there, for example, fluid and biodynamics, subject like a master degree in physics for medicine and biology. This is essential. Teaching has given me the opportunity, to connect engineer, physics, medicine, biology, and all of them inspire students to understand that the healthcare technology from the scientific and the human perspective. We always have to remember that we have to have a human perspective. Probably the third milestone is becoming the president of SAIC. For me, this is a great responsibility, of course, and also a unique opportunity to strengthen the role of the clinical engineering in Spain to promote collaboration between professional and creative and more modern, perhaps open, and of course, and a dynamic society is essential for my side. And of course, and I leave at the end of this speech, is the serving as a chairman of the membership committee of the Global Clinical Engineers Alliance. This international role has allowed to work with professionals from different countries, as you, professor, and cultures, and helping to grow. I believe it's essential a global community of clinical engineers that promote the inclusion, the collaboration, and a word that I love it is to exchange knowledge. It's essential to exchange knowledge worldwide. So we have to share the knowledge that we have, and we have to share with the person who is working in clinical engineer.
Good, very good. I think for those of you that are listening to this podcast and don't know Seville, go there. It's a fantastic city. I had the privilege to go, and it's an amazing city. And I
So
don't disagree with you. That is one of the best cities to live worldwide.
yes,
Really.
the main problem is that in summer the temperature is so high. So
No,
spring and autumn is a good time to visit our city.
yes, you should do it. I mean, when during your career, your role as a clinical engineer, what surprised you most? Can you tell us about that?
So I would like say that one of the most mindful situation in my career is my current role as a president, no, of SAIC, the Spanish Society of Electromedicine and Clinical Engineering, because for me, becoming a president has been a natural step after many years of committing of the society. Before this role, I served as a board member for 2 years, and then as a secretary general for 6 years. So that journey has given me a deep understanding of the society. I can understand the story. I can understand the people who belong then. I also understand perfectly the needs of our profession. At the same time, my new role as a chairman of the membership committee of the Global Clinical Engineers Alliance has been one of the great achievements of my professional career. I'm sure about that. So it's allowed me to work in a bidirectional way between SAIC and Global Clinical Engineers Alliance. So it's made me to make bridge to international knowledge, to share experience, and of course best practice into Spanish clinical engineering community, while also sharing the experience, talent, and the perspective of a Spanish professional with the global community. So it's essential, as I said you before, the exchange of knowledge, this international knowledge. So this connection between the SEIC and the global clinical engineering is especially valuable because the clinical engineering is increasing as a global professional. So this type of challenge, that we face now, for example, digital transformation, artificial intelligence, cybersecurity, sustainability, medical devices safety, healthcare, technology assessment, and equitable access to the technology is essential that we have an equitable access to the technology. And this not can be only for one country. They require international collaboration that we share learning and a strong professional network. So I believe in this type of thing. So it's also a great personal honor. I started in the field around 20 years ago. I still remember my first SEIC Congress with a great affection and of course respect. At the time, I saw that SEIC as a player is a wonderful and a perfect place to learn, to meet college, to understand the real dimension of the clinical engineering. Today, having this opportunity to lead the society and at the same time contribute to the Global Clinical Engineers Alliance is both a privilege and, of course, a responsibility. And in that sense, my role has been to help building bridge. I'm sure about that between a professional, between generation, okay, between hospital and university, okay. So we can do it between Spain also and the international clinical engineering community. So finally, I believe this combination of local leadership and global collaboration is one of the best way to contribute to clinical engineering success around the world, worldwide.
Good, good. I think you are doing the same thing as everybody that reach some places in the, let's just say, the high board of clinical engineers worldwide is climbing the steps. There's no other way. It's difficult to get there just because you are beautiful or because you are intelligent. You have to climb the steps, no doubt.
I share completely their opinion.
Let me ask you about skill sets. Are you missing now that you have a greater impact in your role if you had some kind of skills that is in need for clinical engineers, I would say?
So one of my main goals, for example, to say in that way, is to help to the position of clinical engineering as a strategic discipline in healthcare, not only as a technical support function. We must understand it perfectly. So now we are living through a technological revolution on the planet, on the planet that is probably even deeper than the one we experienced in the early and mid in 1919 with the arrival of and the expansion of internet. No, artificial intelligence is going to transform the healthcare in way that may be, I believe, comparable to the Industrial Revolution, which began in the second half of the 18th century approximately. And it's radically changed the society, I'm sure about. It will change the industry and the way that the people are working now. So we must follow this way. And in healthcare, that we are working on it, artificial intelligence will change how we diagnose, how we monitor, how we plan, how we predict, how we manage research and interact with the patient. But this transformation must be led probably with our responsibilities essential to control it. So clinical engineer need to be involved in ensuring that the artificial intelligence based technology are safe first. Second, ethical. Third one is explicable, so you must understand it. Of course, interoperable, so you must interoperable between them. And it's necessary to be a truly useful for healthcare professional. And of course, because we mustn't forget this, is the patient. We must focus on the patient. Another major goal in the thread of the role of clinical engineering is the cybersecurity. And we're working in a hospital, and hospital are now highly connected technological ecosystem. Medical devices are no longer as isolated pies. Yes, it's isolated pies. We can say that of equipment. So we must connect to network, electronic health, cloud platform, and decision support system. This is created an enormous opportunity, but also it means it could be a big risk. We have to take care about this news risk because cybersecurity, or probably if you have a cybersecurity incident, is not a longer only ET problem. Okay, it can directly affect to a patient safety, clinical continuity, and the trust in the healthcare system. Remember that the ECRI are talking about that in his top 10 during the last two years. So I also believe that the interconnectivity of medical devices and the Internet of Medical Things, the IoMT, will be one of the key areas for the future. Connecting medical devices can improve monitoring efficiency, data integration, predictive maintenance, and of course, clinical decision making. However, they also require strong governance, cybersecurity, interoperability. It's important to define which one are the interoperability standards that we are working on it. Life cycle management is essential to control the devices that we are going to manage. And of course, we need to have a clear strategy for data quality. It's important to have the quality of the data. And of course, they must be safe. It's essential to that. So in the coming year, probably, we would like to contribute to a stronger professional identity for clinical engineer, both in Spain through CEIC and internationally through Global Clinical Engineers Alliance. So we need to present in decision-making process is related with the healthcare technology. Of course, in digital health, of course, too, in artificial intelligence, we talking before, cybersecurity, sustainability, Internet of Things, and patient safety. So also, I would like also to want to build a bridge between the university and the hospital and the industry and the professional society. As a university professor that I saw you before, I strongly believe that the future of clinical engineer depends on the education, depend of the research, depend of the mentoring. Nowadays, for example, I have several students who is working in my department to mentoring them, and also the interdisciplinary collaboration.
You responded all the remaining questions I had.
So sorry for that.
Well, very good. You just go along. That's fine. It's fine. And I think the discussion about artificial intelligence today is one of the main discussions in the clinical engineering field. And looking at it, I just remind you that GCEA is preparing a course for clinical engineers for about artificial intelligence. Ricardo Silva is doing that, and we hope that very soon we can launch the course for
Yes.
members and non-members. Okay, but that's exactly what everybody's talking. Just remind we had a congress here in Brazil, one day congress, and the main theme was artificial intelligence. Wherever you go about clinical engineers, everybody's talking about this. I hope it really helps, and I would say fulfills our expectations about what it can help, where it can help. Let's just see.
Yes,
Um,
we must understand it and we have to work with it. We have to control it, but we have to manage it, but we have to work with it.
yes, agreed. Well, as you respond to the remaining questions, I think I will go for the last one. I mean, and this is a thing that I think you also responded it. But anyway, if you have a magic wand, would you wish for personally and professionally to enhance clinical engineering locally and regionally? What would you do for that?
So it's a really good question. I have to believe in it. So I feel particularly proud of. For example, I'm going to talk about several projects that we are working on it. Now, for example, I'm very proud of the professional team that I work every day in my hospital, now in Hospital Vicente Rocío. So I have to thank them because they manage to more than 26,000 devices. So it's very difficult to manage that. So they are not only a technical achievement, is a collective contribution now. So I also very proud of the new because we incorporated new members of the board of the SEIC. We have a team with young profiles with fresh ideas you talking before, and they ensure that they have a strong desire to work for the society and for the future of the clinical engineering here in Spain, and also try to make bridge that we said before with an international committees. No, for example, it's essential for us. So, of course, I really proud of being part of the Global Clinic Engineer. So, is be member of executive board is a luxury for me. I'm very proud about that. So, for a professional from Spain, no, who was born in a small or medium city like Badajoz, this is a truly dream to come true. So it showed that with committed teamwork and our passion for the profession is possible to contribute not to from local environment to the global progress, as I state, the worldwide that we are talking before, because this is what connected all this project in the same purpose, no, to help create it more update, modern, safe, and probably efficient healthcare working environment. It's essential for the clinical engineer has a key role in building hospital that they are better prepared for the future with a safer technology, with a stronger process, and of course, with it's essential for me the human centered system is. We never forget that the main we must be focused on the patient is essential. So also I would like to explain something that we are prepared here in Spain. It is something special. So I feel very proud to be part of tennis. I would like to highlight it. Is the work that the current begin carry out in Spain around CEINIR. This is the strategic committee for the internal resident engineer. It's something that's similar that we are doing with the doctor. For example, you prepare like a traumatologist, you prepare like ophthalmology. So it's necessary to have a educational program for the engineer who incorporate to the hospital. So I believe this is an urgent need for Spain healthcare system, and in particular for the healthcare system worldwide in general. So we need structure. We need to recognize and also to understand the high quality training pathway for the future of clinical engineer. Just as another healthcare profession that I told you before have their own specialty training model. So for me, project is truly mindful and it's may created a community to that. So this is why this project made me especially proud.
Good. I would say that let's just hope that GCEA will last for 50 years, 100 years, because, of course, the society has to be continuity. And some guy will say, look, there's an old podcast here from 2026, and they start listening to you. And eventually they will say, well, we have everything he said already. Everything is here. We changed. There is no more artificial intelligence. There are something more than this one that this guy was talking. But that was the beginning. That's the point. And this is the nice thing to hear with these podcasts, to leave the memory, for people to learn what are our wishes for clinical engineering today. In 10 years, 20 years time, things will change.
Yes,
Well,
like Bob Dylan say, time is change, no?
that's true. That's true.
Completely true.
Jose, thank you very much for participating in this podcast. And I hope to see you in our several meetings at GCEA. Thank you very much.
Bye bye.